Good afternoon. My name is Catie Kelley. I am a Policy Counsel attorney with Americans United for Life. Thank you for your time and your service today. I respectfully urge your opposition of the End-of-Life Options Acts. I do ask that you not take this opposition as any attempt to trivialize or ignore the pain and suffering that individuals and patients experiencing terminal illnesses and their families have faced. Anyone facing a terminal diagnosis deserves to be treated with kindness, compassion, and hope. I will note I have read the bills, and I do recognize the additional safeguards that Massachusetts has incorporated, especially as compared to other states' possible or enacted legislation. But we do also reiterate the concerns of those in the disability community about bias among the medical profession and insurance companies disproportionately offering medical aid in dying to individuals with disabilities and chronic illnesses instead of prioritizing life-sustaining, life-prolonging, and pain management treatment options. We are also concerned about the preemptive deaths of vulnerable patients who may be suffering from depression that is commonly associated with terminal illnesses, as well as individuals who might be being coerced or who fear being a financial burden to their families if they want to pursue expensive treatment. It is a valid concern that insurance companies may deny coverage for life-saving treatments in lieu of medical aid in dying. As discussed and cited in my written testimony, one doctor reported in 2020 that he referred 2 of his patients who would be terminal without treatment to life-prolonging treatment. Both patients' insurance companies denied coverage for these treatment options and instead offered medical aid in dying. Next, although the physician under this bill is required to refer a patient to a mental health professional, the patient is only required to meet with a mental health professional one time before being evaluated. Diagnoses of depression are highly associated with terminal illnesses, but an accurate depression diagnosis can take time and be significantly impacted by implicit biases on the part of both the mental health professional and the patient. Depression symptoms are commonly masked among elderly patients and those with terminal illnesses, and these symptoms can be affected by the grieving process that is also associated with end-of-life illnesses. In one study, only 6% of psychiatrists reported that they were confident that they could assess a patient's mental state in a single session. These challenges with diagnosing and treating depression in terminally ill patients may result in some individuals being deemed capable, even though they should not have been, after a more thorough evaluation process. Thank you for your time.
Thank you. And Catie, I believe you are from Connecticut?
Our office is based in Washington, D.C.
Okay. I had you signed up saying you were from Connecticut.
Oh, I'm not sure. Oh, you know what? Our Washington, D.C. office is on Connecticut Avenue.
Are you based here in Massachusetts yourself?
No, I am a remote attorney for Americans United for Life, so I actually live in Georgia. But
So I just want to assure you that nobody in the Massachusetts legislature who sits on this committee is looking at this as a trivial issue. So happy to have you here in Massachusetts, and regardless of where any member of this committee falls, I promise you this is not trivial to any of them.
Oh, I can tell. I appreciate it. Thank you.